so people can update themselves and can reach out to us. So thank you for joining us tonight. So my goal tonight is I know some of you, and I know Lorene has, when we initially applied for funding for the multi-site study, CDC had posted the full protocol and questionnaire, and a couple of people have read through that several times, but most of our CAP members have not had the opportunity to do that, and we have not yet run through the entire protocol in terms of the nitty-gritty. In terms of timeline and what we're hoping to do. So what I wanted to do this evening, I thought it might be helpful if I took a few minutes to walk through the core protocol so that we could then kind of regroup and talk about the different work groups we might want to engage in for the assistance and advice we're looking for from the CAP, and then to talk about some logistics. So I really see this meeting today as almost an operational meeting, how we want to operate and who wants to be involved in the different activities and how often we should be meeting. We're hoping to launch this study in the summer in July so that it actually will be here very quickly. And we want to make sure we're able to reach out to the community and be active in the community, answer questions and so on and so forth. So if that sounds okay with everyone, I'm going to walk through some slides. You're welcome to interrupt me and ask questions along the way, but I'll walk you through the different components of the study itself. So here we go. And despite doing this for a year, it always takes me a second. Are you seeing my slides? Did that go to the right page? Excellent. Okay. Okay. So just a refresher, we have the core protocol, and then we have some two smaller studies that will also be incorporating into our planned project. But I'll focus initially on the core protocol, which is the same protocol that will be implemented in all 7 sites. And this is so that we can combine our data and have more data to be able to look at a variety of perfluorinated chemicals and a variety of outcomes in both adults and children. So it gives us more statistical power, gives us more ability to look at additional associations. However, as I've said before, this doesn't mean we won't be able to look at New York by itself or Hoosick Falls and Newburgh by itself. We'll still have that flexibility, but this gives us more opportunity to do that. So the bird's eye view, this is a CDC figure in terms of the entire process of the 5 years of funding. The community engagement, as we've started and we've had several meetings over the last year, and then we've obviously convened the CAPs, is the first component that will be in this figure. I would have designed it slightly differently because the community engagement is the entire process. It goes through the entire study process. We will then be moving into recruitment, data collection, then the analysis. We'll be sharing the individual results with all of the study participants. And I anticipate throughout this process, community events where we talk about our progress and we talk about what findings we're able to discuss. And then the final analysis pulled together in terms of the different statistical analyses we're doing. But to just kind of get you into a little bit more of what we're doing in New York, the plan is to enroll 1,000 adults and 300 children in the 2 communities combined. We're assuming 50-50, so half would be from Newburgh and half from Hoosick. It might be slightly different than that by the time we're done with recruitment, but that is our goal. Once people are deemed eligible, and I'll show you that information in a second, adults and children will be invited to a one-time clinic visit. At the clinic visit, they will provide a blood sample, a urine sample, and answer a health questionnaire. The children will also complete a neurobehavioral set of screenings that I'll show in a minute, but it's basically some are on a tablet, some are at a tabletop, and it's a series of games and word problems, age appropriate. that are standardized testing and screenings for a variety of neurodevelopmental outcomes. We've used some of these same tools in some of my research in other studies in New York State. They're very kid friendly. They're not invasive. It's just some questions. They are time consuming though, so they do take some time. Everyone who participates will receive results of what we measure in the blood. And there will be a reimbursement for up to a total of $75 per visit. It's $25 for the questionnaire, $25 for the biological samples, and $25, Maria, I'm blanking on the third, but I think I have it on a future slide. So I'll bring that up when we get to it. Again, I mentioned we're hoping to launch in July. But prior to July, we hope to host a number of information sessions in both communities leading up to the mailing of those invitation letters. And that's really where we'll look to your help with this process and how best to reach out to the communities, how best to communicate. I'm really hoping we can do some things in person and be able to travel to the communities to do that. We would also like, as we discussed last time, to incorporate some of the youth, and we really like that idea of having some of the high school students. Yes, Mr. Lawson.
So I'm going to try to not dominate the conversation,
Yeah.
but so we spoke with informally two board members,
Mhm.
and we spoke with the director of FACE, the Family and Community Engagement. Her name is Pamela Peterson, and they're both very. Everybody was very receptive. Obviously, one of the board members is Ramona Burton. She's actually on our rack, so and she hasn't been able to participate. But one of the things that um, we at least initially talked about was presenting to the school board about what this study is all about, and then utilizing the school board to sort of their network and their obvious connection to families and communities. That was
Okay,
one thing I wanted to just
that's super.
interject. The other thing I wanted to interject real quickly is again, um, and I know you're going to get to it, is the hiring piece.
Mhm.
So in the NFA, our high school, we have CTE programs, career and technical education programs, and we have a really robust health and services academy.
Okay.
And the one thing that they did mention, that she did mention, was somehow being able to coordinate whether it's paid jobs or whether it's um, on a job training opportunities. That's going to make this go a lot smoother.
Okay.
And then finally, she suggested um, when you do have the job descriptions, because you did say you're going to do some
Yep.
community hiring, that we share them with the FACE committee as well, so that we can work through a process of finding someone that is, engaged in the community.
And just so the job announcements and descriptions are close to being finalized. I spoke to RTI this week and reminded them that we needed to share those with the community for exactly how you just described. Is Ramona Burton the contact person for the CTE program as
No,
well, or is that
the
someone?
contact, there are two people for the
Okay,
CTE program. His name is, the director of the CTE is John Etrie, and the other person is Roger Ramjug.
okay,
But I think what I was going to suggest as we roll this out is that we go together, as opposed to, you might directly reaching out, because it's going to be a warmer call if we go together.
absolutely. And that's exactly the kind of where I'm hoping we can get to um, uh, with this meeting tonight is to figure out the work groups and who can help us make connections and work with you. And so that's excellent. So thank you very much for doing that
One
initial.
last thing.
Yeah.
So I'm sure you might be familiar, or some people on the call are familiar with the American Rescue Act plan, the funds that are coming down. New York State is going to get about $8 billion. And what they're looking to do is have summer camps, right, to engage kids back into school and get them ready to, you know, s- get back to normal. And so there's a really unique opportunity to do like sort of health science camps around some of the recruitment and informational sessions, right? So, and I'm going to stop talking now because I know you got a lot to present.
That's super idea. And actually, I'm going to make a note. One of my, actually, she's my former student, but she runs the Radix Center here in Albany, which is in the south end of Albany, and they run summer camps for the high school, and they do testing in the Hudson River and in the area. So I can chat with her about ideas, but those are good leads. So thank you. That's excellent. Okay, so invitations we're hoping to send out in early, in beginning in July, but obviously lots of connection before then, with the clinic visits to begin September 1st or thereabouts. And we have early up to early winter. I would obviously like to get it done before we really go into the brutal cold of winter, but fall, early winter for the recruitment coming into the clinic sites. Now, one of the things we're working on with ATSDR, there will be results reporting from multiple places. In New York, this was actually something that our Newburgh collaborators requested at the time, and we agreed that it was a good idea. But for all of our participants in Hoosick and Newburgh, we're going to get an extra tube of blood. So for those who have had blood drawn before, we'll have what's called a butterfly tube. So we'll get multiple tubes in one time. We're not going to stick people multiple times. It'll just be one stick. And we will gather a tube on our own to send to the Wadsworth labs here to test for metals with consent. And so people will get the results from Wadsworth on the metals measurement. And then the other results related to the biological markers and the measurements of PFAS will come from ATSDR CDC. And those might take a while. They have told us to let people know that it could take up to 2 years, but the PIs are well aware that that's a long time. So we're going to try and get some clarity on the length of time of what that actually means. But so that's one of the open questions we have. In terms of who's eligible. So for the adults, it's 18 years of age or older that have lived in Newburgh or Hoosick Falls sometime between 2005 and 2016. So 2016 in both communities, different months of 2016, but in 2016, the drinking water was changed, the filters were put on, or the drinking water location was changed. So we need people who lived in the areas in between those two time frames. Because this study is designed to look at effects of drinking water, or what I would sometimes refer to as an environmental study, not occupational. The protocol for everyone is that if you've worked as a firefighter, professional firefighter, or have trained with AFFF firefighting foam, you would not be eligible for this core study. There are other studies ongoing that NIOSH, that's the National Institute of Occupational Safety and Health, are forming for firefighters. And we actually, I've made a note as we were getting online to make sure we could put those links and that information on our website. So people who are firefighters will know where to go for that additional information. We also have, as a condition, you have not worked in an industrial facility that used PFAS chemicals in the manufacturing process, to the best of your knowledge. And so, and have occupationally worked with PFAS. And again, that's because they're interested in exposures to those that are environmental exposures and not the occupational exposures, which tend to be different. For the children, it's children aged 4 through 17 who also lived in Newburgh or Hoosick Falls during that same time frame, or were delivered to mothers who lived in Hoosick Falls and Newburgh during that time frame when they were pregnant, or breastfed them, based on that. So it could be that if somebody has moved away, but they were pregnant during that time and living in Hoosick Falls and Newburgh and breastfed their baby, then they could be eligible if they wanted to come back, in theory, for that. The process will be, we will mail invitation letters to both communities. We will have invitation letters in Spanish, Haitian Creole, and English. We will, one question we have, Lorene, we've made the assumption that Hoosick Falls may only need English and not Spanish, but we can certainly discuss that. And it's a one-page invitation letter, so it could very easily be English and Spanish on either side. But that's one of the questions that we had. During the eligibility screening, so people get an invitation letter. We have contact information. If they want to participate, they can reach out to us via toll-free phone number, via text message, via our email, and we will contact them to do the eligibility screen and to enroll them and set up a clinic schedule. And at that eligibility screen, we will be asking for a preferred language. And from that point on, we will always send any material as well as communicate over the phone in what their preferred language is. We will have staff who are are fluent in Spanish and Haitian Creole, and we will make sure that that opportunity is there. And so we will, again, and we've only listed the toll-free number here, but we have other options as well with the text messaging and the email.
On that day, on that mailing, Erin, are you using for a mailing database the people here in Hoosick Falls that did the blood testing before?
We're not limiting to those who have done the blood testing. We do, and we've actually had this as a discussion. We have a database of people who have participated in the biomonitoring previously. And we have talked about sending them a letter, just letting them know that this study is coming up, and if to be on the lookout for it. But we want to make sure and open this opportunity up to people beyond those who participated in the biomonitoring.
So it'll be basically like resident mailing?
Yeah,
like,
it'll be
okay.
a resident mailing to those on the drinking water supply. Now in Newburgh, we are working with a company that will help us identify individual mailing letters because of the number of residents that have apartments and rental buildings. So we don't want it to go to a landlord. We want it going to the people who actually live in those locations. So we're working on with a company that's able to help us develop that database of addresses so that it goes directly to the people living there. And then we will send letters for that group. And again, we can send letters to the people who participated in biomonitoring in Newburgh as well, but it's very important in Newburgh in particular that we know there are a lot of communities that may have been affected that did not participate in biomonitoring. So we want to make sure they know that they're eligible and able to participate in this study, especially our Spanish speaking and Haitian Creole speaking communities, because there are communities that might not know as much about what's going on with the study. Okay, and for those who get a letter, but they don't immediately contact us, we had to submit an ethics review. So part of our protocol is to contact them up to 3 times. One of those contacts would be a postcard reminder, and then we would attempt to call personally 1 or 2 times to see if they are interested, and then conduct the eligibility screen in that way. And that's just to make sure, some people will get a letter in the mail, they're not sure if they should respond right away. And so this will give us an opportunity to reach out in person with that. And my sense is throughout this, even after we start recruitment, we would still be making trips and being out in the communities, in both communities, to let them know about the study and to answer questions. And we will continue to recruit right up until we get the number that we need for the study. Once an appointment has been scheduled over the phone, we will mail a clinic appointment packet that has the reminder card, a copy of the informed consent materials, again, in their preferred language. They don't need to sign this ahead of time. There will be staff on the day of the clinic visit to walk them through the full consent, but we like to send it ahead of time so they can read it and they can reach out with questions if they want. We also have the study fact sheet, and we'll talk more about that in a second. And we have for an appointment prep infographic. This is something CDC talked about. It talks about for the blood sample, ideally we would like a fasting sample for the blood so that we can measure lipids. But that takes a little bit of preparation, and we will let people know about that on the eligibility screen. And if there are any special considerations that they're worried about, we can take that into account. And then the urine collection supplies that they can bring with them to the visit, but both sites do have bathrooms, especially for those with children, if they forget or need to wait until they arrive, that's fine. And I think that's it. They will also get 24 hours before the call, just like you do with a regular doctor's visit. They will get a reminder call from staff, and we'll have directions to the clinic as well. So I went, it's funny, I had not traveled outside of Albany since last March, but I did drive and visit both the Fullerton site in Newburgh and the Hoosick Falls site. And as we mentioned the last time, especially with the Newburgh site, the advantage to that particular site was that it was set up to be a clinic. And when I went in, it's actually very up to date and did not need much work other than cleaning. So that was the advantage. But we heard last time that regardless of where we have it, we need to address transportation. So what we're doing, and we could use some feedback from all of you as well. We've reached out to the county health department, as well as a few other organizations, because we've set aside some money in the budget for vouchers for taxi or Uber. We haven't finalized any of this yet. I was also interested in knowing if there were any not-for-profits in the area that provided rides for, sometimes to help people get to doctor's appointments or voting or things like that we could perhaps partner with. And so we want to make sure we have transportation to the corner. There is parking, and it was a very active place when I visited. But it is laid out well. It's accessible for people in wheelchairs or who need walkers. So that was also helpful. And it's big enough to accommodate the children and freezers and whatnot. So that was the Newburgh site. In Hoosick, I went and visited, and that's also already set up to be a clinic site. It's been empty for several years, so they'll have a little bit more deeper cleaning to do there, but they're working with us on that, and that is right on Main Street, and seemed familiar, and it was easy to get to, and there's again parking and room for staff, because we will need staff there as well. And it has the privacy already built in, because again, both sites have the privacy for the clinic, and we needed the sinks and all the extra safety alarms and things like that we need for these types of sites. So that was the advantage there. So that's, and I know there was some discussion about trying to move downtown to Hoosick, but we would still have transportation issues. So that was the benefit of working with them, and we could do a lease for less than a year. Was the other challenge. So that's what we're thinking. We are actively exploring ideas for transportation. So if any of our folks in Newburgh have some thoughts on that route, let us know, but we'll continue to work on that. Okay. So in terms of what's happening on the at the clinic visit itself, it's about a 1.5 to 2 hour visit. So it's a longish visit. And we'll let everyone know that that's the case right up front. There'll be height and weight measurements, a blood pressure check, blood sample collection, and then there's a questionnaire for the adults that they can answer while they're there. For the children, in addition to the biologic measurements, we are doing, as I said, the neurobehavioral assessment that again is done at the same time. And the parents are there while we're doing that. There is an option for parents to come back for the child's neurobehavioral assessment if it's getting to be too long for them, or they have another meeting. We would just, based on experience, it's a little, actually in the long run, it's easier for the families and the scientists. It's hard to get people to come back because people are busy. So we'll try and keep that on the same day if possible, but we will have some flexibility if needed. And we will also ask for consent, and this is the other reason to talk to the school boards in both communities. We will ask for consent to abstract the medical records, as well as to for permission to abstract information from the school records. And we have, and this primarily what we're really interested in is if students have IEPs, if they have special accommodations for learning. And so we have language, and maybe for the next meeting, we can pull some of those draft protocols out. Again, this will be applied for all of the 7 sites with that, so that you can see it and we can talk to the school board. Yes, Mr. Lawson.
That consent piece, is that a part of the eligibility process, or is it at the clinic visit you're trying
It's
to do?
at the clinic visit, but we will send them the information ahead of time and we'll describe that information. So that's a separate consent. And with all of the whole process, people will have the flexibility to say no to different components.
Yeah, the only reason why I was asking, because in my experience, that consent can jam you up, especially if it relates to, if they say no, they have the right to say no, but that doesn't help your 500 or 1,000 number.
Right.
So I just wanted to suggest possibly that as far as the invitation or the outreach and those processes before they actually get to the clinic, that people are aware that this consent is critical or important,
Okay.
so that it can get done.
Okay.
'Cause
Yeah. No,
kind
and
of
we
a-
can share
yeah.
that. Yeah, no, that's a good point. And we can, because we're not going to go trolling through all the records. It's very specific pieces of information. So we can draft some language, and we have some as well from the protocol approvals, so people can see what we're looking for and why it's important for us to know. But again, it's to confirm some of these neurodevelopmental outcomes. And one of the best ways to confirm that is whether or not they need assistance at school. And so that's where some of that information comes from. So we can show that and talk about it and have that in the packet of consent forms that we send ahead of time. And then they sign. They don't need to sign anything until they come, if they have questions for us. Okay, that's a good point. Thank you. So here we go. And the card breakdown. So that's right. There's another $25 for the child's component. So for families that are participating, it's a total of $75. For adults, it would be $50, and then another $25 for the child in gift cards that we will distribute. So again, in terms of what we're measuring, all of the clinic samples for the core protocol will be sent to the same laboratory. This is important for consistency, so we don't have error or differences by laboratory. The biomarkers will include lipids or cholesterol levels, thyroid hormone levels. In the children, we'll be measuring sex hormones. This is to look at markers related to puberty or interference with the endocrine system. Kidney function, immune system function, liver enzymes, and then the metals that I talked about. And that's unique to New York site. And so those will come in a separate report from New York. We'll also measure in the urine kidney function, and the PFAS will be measured in the blood, and to some degree, we'll measure that in the blood, and then the urine has the kidney function. I think we'll change that bullet. And then
I'm sorry, Dr. Bell, is there a difference between the top report and the PFAS report? Because you mentioned it's going to take 2 years to get back. That's not the cholesterol and the thyroid stuff, is it?
No, that should come back. That's one of the questions I have. It's 2 different labs. You're correct. So the CDC will be analyzing the PFAS in the blood samples. The DOH will measure the metals in the blood samples. So that'll be another report. And then there's a different lab that has been identified to measure for the biomarkers. And so one of the notes I have here, and Maria, maybe you can also make a note so that you can back me up. We will reach out to CDC. It's one of the questions we have in terms of how those reports will come, and are they truly going to be just one report at the end, or are they going to come in or will they be mailed as the information comes in?
I was just thinking,
Yeah.
marketing wise, because if you can get the cholesterol and some of these other functioning things back to people sooner, that's a better marketing tool than to say, all this blood work is going to happen 2 years from now. Because you're right. I see you note that you can take this to your primary care physician, so that you can begin some of the positive conversations with folk, and they feel like this is something that is not just a study, but something that is actually can help with their particular
Right.
health.
Because waiting 2 years on the biomarkers, it's not, by that point, it's moot. So, okay, no, that's excellent feedback, and we'll definitely reach out. And we've identified that as an issue as well. So that'll be helpful, and to clarify how they plan to send this information. So again, this is at the end, it's a research study. So and we'll be upfront about that, very transparent. This is to provide information for the research community, but also the researchers who are trying to provide information to risk assessment and to the data that's needed to set regulatory levels. They use epidemiology studies to provide that information. And so that's really kind of the goal of this. We will provide advice and assistance to the medical professionals. ATSDR and CDC has already started that process in terms of providing opportunities to train clinicians in the communities on what these reports will say and how they might interpret them. This is also the goal behind the National Academy of Medicine Committee. That's one of the recommendations, is to help provide some, inform the physicians on how to respond to this information. Most physicians are not trained in environmental science, so this is an opportunity to train them. And we will be providing a summary of the aggregate study findings to the community and to do presentations. We will also be, with anything research, it's important that we publish in the peer-reviewed literature. And what that means is we develop manuscripts and it's reviewed by other scientists and published in known public health and science journals. And that's important for the community, because when committees are assembled to review the data to set regulation and to set regulatory and policy changes, they typically focus and give the most weight to the peer-reviewed published literature. And so that's why it's important that we have that as part of our goal, that we work with CDC on a report, but that also the scientists work together to get out the manuscripts and have them published, so that data can then be used as information as these regulatory agencies and policy committees move forward. And so that's why that's particularly important. As we, the priority right now is to really focus on recruitment, but a secondary discussion that we'll be having through the spring is how to share information with the community as we're moving along, and as we're starting the analyses. Certainly once something is published, we can, just like we do now, talk about that published literature, but we would very much like to keep communicating with the community and the study participants about progress, how we're doing on the analyses. I have some thoughts on that, but we'll work with the CAPS on how best to do that and how best to share what we're learning. And then here, once again, is our toll-free number, our website, and Facebook pages that we'll make heavy use of, and our email that we'll continue to use for communications. But I'm going to pause there for a second and stop sharing so I can see the screens more. So are there any questions at this point?
Erin, I'll ask, we have a community working group meeting next week. I'll ask them if they think we need anything printed in Spanish and get back to you.
Okay, thank you. Thank you. That's very helpful. We weren't sure. We didn't want to assume. So that would be great.
You share the PowerPoint?
Yes, and we'll also be posting this to the website, but we'll send it out to the CAT meetings. I can have Aaron do that after the meeting. And people are certainly, as you contemplate and think about it, if you're welcome to email us with questions, and we can certainly expand on that as we move forward.
As I'm thinking about it also, why don't we pencil you in? So our community working group changed a little bit. We're doing our public meeting every other month.
Okay.
That gives us time, and we're still meeting every month, but we're doing the public every other month. So if we have you come in June, which would be our next one, that would be close to release, you know, for the mailings and stuff, and have you do a presentation then too.
That's good. And then we should also coordinate with both of you how, you know, in terms of reaching out to the school boards.
Yep. Well, Pat Daly, the superintendent, is on the committee, so we can make sure he's there and give his input as well. But we can have you come like even during our off month. You can still come and present to us during our private meeting
fine.
too. So if May or June works better, pick one.
And I can look at the calendar and see. I think the school boards, we should probably plan on meeting with the school boards sooner rather than later. Although I suspect now, I would assume the month of May, they're talking budget. But if there was a time or, you know, I don't know.
Do you have Pat Daly's email? I think you do, don't you?
Probably do. I can look.
If you don't have it, hit me up and I'll forward it to you.
Yeah, I agree with you that getting you on the agenda. I would like to get you on the agenda. What they do and I'm sure it's the same way with Lorraine, is that they have you can speak for 3 minutes. Anybody can step up if you put yourself on the agenda. I mean, I'm going to do that, but I didn't really want that because I really wanted you to be able to share, and I wanted to be able to share about why this is important. So I wanted you to get on the agenda. So that's what I'm working on.
Okay.
I'm trying to create a space where you can get like 15 to 20 minutes on the agenda to speak to the school board, to get, you know, the board to say, yeah, we want to do this, because that's a different level of expediency.
Yeah, no, I fully agree. So why don't we can communicate, you and I, over the next few days, and whatever you need me, I'll let you guide me a little bit on how.
Yeah, I mean, quite simply, the way it gets done is we don't do it. We connect with someone in the school district, like a John Etree or of the family and community engagement director, and say, you put this on the agenda because you have an issue in your department. So that's how we.
Okay. All right, sounds good.
And we can also, because Rob's also on the CPWG, maybe he can pencil you in for a small presentation on the future village board meeting as well, because people tune in to watch them on Zoom now too. So you'll have both opportunities at the CAG and then at the village board meeting.
Oh, that sounds good. Okay. Perfect. Okay, so based on our last meeting, and then in thinking about this, we definitely, the group thought about 3 different work groups. And we can discuss this tonight, whether or not we have distinct work groups, or, you know, people can obviously participate in more than one work group, but we thought that we had 3 different themes that we would need some help on. The first one is community engagement strategies for recruitment and communicating with the community, and in terms of priorities for that group. The first would be to create a fact sheet that, as we discussed last time, we have the formal fact sheet that CDC and ATSDR, and then with our slight changes, have made, that we'll use for our, you know, when we need to communicate with government and need to communicate with people outside of New York or not participating in the study, but that we would like to develop a fact sheet, as you suggested, that is community focused, and with heavy input from the CAP. And so this would come under the purview of the work group, in part because if we tried to all do all of these things, we wouldn't get anything done. We wouldn't get things done in time before we launch. So this was partly to be somewhat more nimble. So the goal of the community engagement strategies would be this worksheet, this fact sheet, and then think about media marketing. Again, whether or not there's some radio stations, if we need to do, we could do an interview if there was a school radio station or local newspapers, those types of things that we should communicate with. And as we've talked, other opportunities for community involvement in developing our materials. But really, so starting with this fact sheet and then other ideas for having some in-person information sessions and things like that, how best to reach the community. The second work group was around this idea of student engagement, participation. How do we, and already we've had some feedback on that in terms of working with the schools and some of the programs available so that high school and college age students can be involved. And then we have something that acknowledges the younger students' participation for those who are in the study itself. I even had, I don't know, I had this little thought in my head that we typically have a launch event. So on the day we begin recruitment, similar to what they did in Newburgh for the exposure assessment, there was this launch event and they had people speak. But in my mind, it's, if we had students do posters about perfluorinated chemicals or environmental exposures or things that I heard last time that in Newburgh there were students in, again, the science training program or things like that. So any art that they come up with. So things like that we could engage the younger people in would be great. And then a third work group, a little bit on study logistics. This group might overlap a little bit with the community engagement. So again, planning kind of the study launch, thinking about recruitment. What are some things we need to consider? Transportation. What do we need to, if, you know, who are the go-to people we can talk to about some of these logistical issues and things we want to make sure of. And then this, thank you for, people have been forwarding us grant opportunities, which is great, to fund some other components. I would also like to talk about, you know, some context here. I have colleagues here who also do this type of work and they're particularly interested in engaging, especially in Newburgh, because of their particular research interests. And so I would like to start facilitating those introductions. So that if there are ideas or needs that can move forward, I would like to have some context for that. Partly because I know my time's going to get pretty tight as we get closer to the study launch. But I have, for example, I have a colleague who works around issues around aging and caregiver health and is interested in some aspects that I think align nicely with some of the other needs and things I've heard about in Newburgh. And so there are those types of contexts as well. So those are really the three main work groups, and then a fourth that would be contacts and ideas to work on grant funding and things like that. Does that align with what you were thinking?
It does for me. I think, as you mentioned, there's a lot of overlap, but I think it's good to call it out this way. The only thing I might add is going back up to the community engagement piece, is that we use that term community engagement, but what we really mean is we're engaging people and we're engaging families. And so I think just really understanding our audience, or just a note in our heads, who is our audience and what are we trying to accomplish, and why are we going to try to accomplish it, and then how are we going to try to accomplish it. So I agree with everything that you have there, but I just wanted to say that out loud.
Yeah.
Because oftentimes it's not an amorphous community out there.
Yeah.
It's specific.
Yeah, and Mr. Lawson, I think that that's a fantastic point. And one of the things that I think we may go into this and go, we're not talking about a fact sheet, we're talking about a marketing plan for this to reach various target audiences with a budget to do some direct outreach. You know, that might be the best way to do this. We might think about things that need to slip into directly into recruitment materials. And I think we may think of things that where we can get students involved directly in artwork, or, you know, to come up with a workforce for this. So I love that point, that this is really all about who's our target audiences and what are the key messages that we want to convey and what are the actions that we want them to take as a result of the information that we're providing. And I think that that really bubbled up very clearly at the last meeting when we were talking to you about our study fact sheet. It misses that component of who we're talking to. It talks overall programmatically, you know, about what the study objectives are, but it doesn't have the hooks, I think, to get people in to participate.
Just like to add, the other thing that I know Pease has done is they took yard signs like the size of a political sign and put the study information on yard signs and place them throughout their neighborhoods. I don't know how expensive they are. Most of your, I want any money for, you know, to promote participation and all that. I think you're find more of it Newburgh's going to need versus our tiny ass little town here, right? So, you know, you drive through and in 4 minutes you're through it, right? So, but I was thinking, you know, again, between our village board and our CPWG, and then if you hit up the school, if we get some of those, I don't know, 6 perfectly placed signs, there's no place in Hoosick Falls you can drive by where you wouldn't see one. So I thought that was a really good idea.
No, and there might be things that, you know, we can have different things in each community that speak to the needs of each community. I almost think we were able to get a template of what they used in Pease for those signs that we could
Okay.
adapt and use, you know, specific logos. But I agree. I think in Hoosick that might be particularly effective. Newburgh, I would rely on the Newburgh folks to talk about what
they're going to have 10 times more issues, you know, getting participants just due to their size. You know, so we here, we don't worry about that as much. Again, we have 2 local papers that report on our CAGs and the village board. So the word will get out here again, because we're so small. So really, I just say focus on the poor Newburgh folks for that kind of thing. And we can, you know, I'm the only one here. I think I'm still the only one. I don't know if Michael's on or not.
Hold on to that. We're going to discuss that at the end of the meeting today on, you know, who we have. So let me ask you this. So 2 questions. How should we populate the work groups? And my idea is that I just, again, to keep things flowing, I on this end will make sure we have at least one staff member, probably more, on each of the work groups. And that's how internally we'll make sure the work groups, we have information that's shared across the work groups, but also there's always a known staff person that you can reach out to and talk to and can coordinate meetings from an efficiency standpoint. But in terms of those of you on the CAP, should we have people volunteer for work groups? Are there additional people not officially on the CAP that we should include on a work group? That's also a possibility. If there are some experts or folks that, you know, maybe don't have the time to be fully on the CAP, but would be particularly helpful to enlist for a work group session.
Well, again, as we get busier with this, I imagine for us here, you know, I'm going to ask our whole community working group to do whatever they can, you know, as far as what needs to be done here. So I'm not doing it by myself, or, you know, there's only 2 of us. I'm sure our whole, you know, working group will pitch in with whatever needs to be done.
I mean, as I look at the groups, I would like to volunteer for all 4, but being realistic, I probably would drop off of the study logistics and you know, participate in the A, B, and C, D.
Okay. All right.
Yeah, and that's the other. I've never written a grant before. I mean, I know we help participate in getting this, but I've never written a grant. And the way I understand it, they're quite the pain in the behind. How much participation do you want on something like that from us,
You know,
who have never done such a
I
thing?
think it just depends on what the opportunity is, and you know, some grants come along, what we simply need is we can handle the writing, and maybe coordinating letters of support from the community would be helpful. Others, in this case, these grants here, actually why I like them is that they're written with the community, and the community helps drive what is needed. And so that takes a little bit more work. But I think that, and it's again looking for the right opportunity for this study, and then if other opportunities come along that perhaps don't fit into what we're doing, but do, it's nice for me to know about them because I know a lot of other people here who do similar work that would, in other health outcomes and other exposures that might be of interest. So I think that the workload for that work group will go up and down depending on what we're working on in the meeting. The priorities to me, the big one that needs to get going relatively quickly is the community, the marketing spreadsheet, because we need to develop some materials. And again, the student engagement also, we have to get moving relatively quickly because the end of the school year will be here quickly, and it'll be easier to get a hold of people and start the process before the end of the school year, especially since we're recruiting. Yes.
So I talked about it earlier, but I mean, getting back to that point, I think we need to be really intentional and purposeful. To your point, let's get it going. And so I think what might be very helpful is in both Hoosick Fall and in Newburgh, developing sort of this action plan or this strategy.
Okay.
So I think what we're saying is we need to, like you mentioned, we can talk offline. Let's get a strategy to get a presentation to the school board, because if we get that done, there's 11,000 students in the school district. And so if we can develop a strategy in conjunction with the family and community engagement director, that's half the battle, right? They already have things in place that we can sort of align to. I mean, they have a website, they have, parent, what do they call them? Liaisons or parent coordinators. And so those are the types of things. The other thing that I think is really critical is the CTE angle and getting into the Health Service Academy, talking to the people that run that and sort of aligning with them. Because I think actually the students can graduate with a phlebotomy
Yeah.
certification.
Okay.
So hello, like you're gonna be,
We need phlebotomists.
right. And so whether we can pay the students or whether it becomes, like I said, part of their hands-on vocational training as a result of their training, like we can talk specifically with the people that run that program. I think a doctor leads it, and they have a couple of nurse practitioners that are part of it. So again, let's have conversations with the school board. Let's have conversations with them, because it might not be as difficult as we're making it out to be.
Okay. And I'll pull in what I forgot to mention, although I introduced you last time, is the Research Triangle Institute is the company that will be hiring and coordinating our clinic visits. So this is the group that they have a lot of experience in this area, and because we had two sites pretty far apart from one another, we asked them to coordinate. So I will reach out to Suzanne, and so I think as we get moving and with these discussions with CTE, we'll want to talk to them. And as I mentioned, they're drafting the job descriptions.
One last thing, Dr. Bell. So down to the grant resources and support activities, I did mention the American Rescue Plan. I really wanted to just dig into that for a little bit.
Okay.
What's going to happen is, and I work with an organization called Mentoring in Medicine. They do amazing work around helping students in science and math and engineering go into healthcare professions. And they actually have doctors and nurse practitioners and nurses, not I'm going to call it the ghettoization of healthcare professions, where you're talking about nurses and CNAs, which is what the Health Service Academy does. They're talking about careers in health service. And so one of the things that they do is they have a living science, they call it a study jam, and they get kids and kids are passing their living science regents.
Great.
And so I think, again, when we have that conversation with RTI, and when we have that conversation with CTE at Newburgh, I would like to incorporate them under this rescue plan piece, because they're going to be doing stuff this summer. They have money that they're getting from the federal government. And so there may be an opportunity for us to incorporate the summer camp element of what they're going to do with this funding and the work that we're trying to do with the research.
Yeah, well, and as you're talking, and we'll definitely have a longer meeting to discuss. I mean, there are also, in addition to this research, there are some related entities at the University of Albany that I think might also be a nice conduit or partner with some of these opportunities too, that work with high school. There's some high school programs that we have for research and training, but there's also some of our own undergraduate students have there's a Doctors for Hope group, and we have some public health students who are in a mentoring program and things like that. So I think there might be some additional components that we could add from a mentoring standpoint that make a lot of sense. Okay, so I think you and I will need to set up a meeting maybe for next week.
Yep.
And discuss these things in more depth. And what I'm hearing is maybe what we can do for the work groups, we can send out an email and have people let us know which work groups they would like to be part of. And then I will again assign staff, and they'll send an introductory email so that we can start setting up meetings to meet and move forward on some of these deliverables and talk about an action plan for each work group and what's needed. Does that sound helpful? Did I interpret everything right? Okay. So we'll move forward with that. Part of that, and maybe what we can do at the work group level, is if there are additional people that we need to include on the work group or pull in for assistance with something or for expertise or even just to meet with, that can also be determined at that time when you meet with the work group. So I anticipate, especially for the work groups A and B here, to meet relatively soon to move forward on some of these activities. Does that sound good? Okay.
Erin,
Yeah,
I just,
an email for the signups is good.
Okay.
That sounds good.
Okay.
Erin, also, I'm trying to remember, we have money set aside, right, in the grant for marketing, like for social and digital too, right?
Yeah.
A little bit, but a little bit goes a long way with this stuff as well, so I just want to put that in the mix too for the outreach pieces around recruitment is how we were initially thinking about using that, getting people ready to see those packets land in their mailbox and go, oh yeah, I was looking out for this would be, another thing. So not that that's a last hook, I think.
Yeah, we have a little bit of funding for that. And the media marketing folks at UAlbany have also said that they would help us draft ideas. And I think, again, a joint meeting with you and them, once we have a better sense of what we might need would be in the future. Is email the best way to communicate with everybody? In terms of, okay, so we'll send this email to sign up and we'll get the work groups to schedule a meeting. In terms of the full group meeting, because we'll be relatively busy, should we assume a monthly meeting? What do you think? Knowing that we're gonna have work group meetings on top of this. Yeah.
So if we're going to have work group meetings, I think they can be more frequent and we can keep the monthly meeting. But I think we got to pick up the pace if we're, so now that we're going to have the work group meetings, I think having the monthly is fine, but certainly the work groups, we got to pick it up.
Absolutely.
Yeah, monthly
so
for now, and then maybe like the month of, so if you're going to start in July, come June, schedule whatever you have to do. So when the July rollout comes, we're ready.
Okay. Is this date, part of me wants to say, is this day and time accurate, but there not as many of you could come tonight. So rather than sending out a doodle for the monthly poll, I was hoping to set up a day or a time, but maybe what we can do is roll that into that email where we're asking people for their work group preference and just suggest, have them check off or stick with evenings But Monday, Tuesday, Wednesday, Thursday, Friday, and have people check off the, general time that they think works.
Yeah, in the last week of the month, both for Newburgh and Hoosick Falls are
So we'd have to,
our community meetings. So, yeah.
and then the rack is in there too, towards the end. So, okay. All right, so we'll do it that way. Are there, that you know of now, are there folks, particularly for Hoosick, Lorraine, since you and Emily are it, are there other folks that should be invited to the CAP? From the town, is there any from the town?
Everybody's, with COVID, it's like short of our members. And it may be easier now because our water supply study came out yesterday. So we might have a little bit more interaction now with the public that we just have not had in the past year, right? So we're not out talking to people. We're not out, all getting together or anything. So at this moment, I mean, you can put it all on me and I'll just grab whoever I need to when I need help,
This, as the work groups, when they work groups meet and have that first meeting to line out what their agenda is, at that point, you'll know what the workload is and say, hey, let's invite some.
Yeah, then I can grab somebody and say, I need help with this, and
This is what we're
can
working
you say, I mean, and again, I can probably grab several members of the working group.
Okay.
So
The same is true for Newburgh as we kind of line out these work groups and the work groups just, line out their agenda and what we need to get done in the time frame, and then can perhaps reach out and ask people and show them this is what we need to do for the next 2 months.
Yeah. So in Newburgh, what we would, so I mentioned to you Ramona Burton, who happens to be a board member. We're going to drag her into this. She's actually a RAC member, and she hasn't been able to participate because of school board and COVID and all this other stuff. So I'm going to guilt her into helping me on some of these committees to, yeah. So that's how that's going to work. And then we have an ally now on the school board that can sort of get us in the mix.
Okay. All right. Any other questions?
how did you have you dove into Katie Pelch's study
little
there
bit.
yet?
Yeah, so we're gonna post it. I didn't check our website already. So this week, colleagues in Texas, I think, is where they've been.
She's in Texas now, but she worked with many others on it.
Have put together a database of all of the literature that has come out on PFAS, the whole gamut, or a number of different all the different types of PFAS and the literature, and created. I was interested to see how she was going to do it. So she has a very nice website. Actually, let me see. Can I pull it up quickly? Maria Galuzzo, is it on our site already or no?
It is not, but it'll be up with the end of the month update.
So I don't know if I can find it.
If I recall, there are 756 studies they found related to PFAS up to 2019. Since they finished it, there are 400 more.
Yeah, and
it's going to be added on to as it goes.
Yeah, here we go.
So there's over 1,000 studies to be found,
So here's the database, and we'll have this link on our website. And what I really liked is they have a health outcome tab that actually explained what it means when we say we're going to look at musculoskeletal outcomes, for example. And they did a really nice job of making this just kind of user friendly. And then the different chemicals, these are all the different chemicals of PFAS that the different studies are looking at. And the database itself takes a minute. So this is what comes up. So I think this will complement what we're trying to do on our website, because what this is obviously very busy. This shows for the different health outcomes, the number of studies that have looked at PFNA, for example. And then if you click on it, up comes, I think, well, I'm not sure what happens actually. You can select it, and then I think there's a here it is. You can download the study list, and I think you might even be able to pull up the actual article if you play with this a little bit more. There it is. So all the human studies that I've looked at, but these things are a little easier to look at. Now, on our data, our website, what we're doing is for each study that has come out in the last 5 years, we're doing a lay summary of what is what it means, and then with a link to the abstract, and they can get the downloadable article. And with Lorraine's, what we'll be updating is under each heading for reproductive outcomes, we're going to do a little summary of what that means, like what outcomes are actually included in that section. So the two can be used together. So for those who kind of want to see the totality out of all of the other thing we've done on our website, we've limited to the health outcomes that we're looking at in the core protocol. So this has all of them listed so that you can see everything. So between this database and what we're posting, people will have the ability to look up a lot of information related to that. Yes.
Let me apologize for delaying on my sending you studies. I've just been
That's
so
okay.
straight out this month, as you probably know. But
Okay.
also, if you have any questions, if anybody has questions on that study you just showed, I know Katie.
Okay.
And so I can get in touch with her if somebody has questions or whatever. She's phenomenal.
Yeah, no, this is fun. Mr. Lawson had a
Yeah,
question.
so so in the email, you had asked, and you shared the link to the PFAS published research articles, and then you shared you had an attachment on how to research articles. So it was that for the CAP?
So the so here, let me show you that the attachment on how to review research articles. We have that was for our internal use in term what we've used something along those lines. I use something similar to that for my students. I don't think, let me pull, I'm going to pull this up and I'll share my screen 1 second. We were wondering if we should have something like that on this site to try and make it somewhat easier. But if we go here, so here's our published, and what we will be updating, so let me click on reproductive, is now under reproductive, there'll be a brief overview of what outcomes fall under reproductive and in general what we find with that. And then you have the listing of each of the studies that have been published in this category with a very brief, and we'll update some of these study conclusions, but with a very brief update on what the study conclusion is. And then if you click on it, up comes the actual article.
Yeah. So you were asking us, let us know about if the plain language used for the literature page is easy to understand. And so I was going to say, or say no, but when you showed us your colleagues, the one with the stick, that one was brilliant, right? Like that
Okay.
one, and notice what they did. They were going to the specific disease as opposed to, because see, lay people is difficult for them to associate. Okay, what about the infant? The next screen you went to.
Yep, I'm gonna reshare. Here we go.
This one, this is great, right? Because it's going to the specific body weight, size, and growth, musculoskeletal system, cancers. People understand that. Now imagine if you did it in reverse. If you had this, but then you had the articles that related to the
Under this,
articles under that, like that, so that now when I went here, these are people will understand that because they say body weight, size, and growth. Body weights are general measures of health throughout all stages of life. That's something that a 7th grader could read and understand. Then you can get more detailed. But if you start off this way, you won't.
we can do that. We can reshuffle, recategorize, and use these headings in this way because we're going to post this. They can use them together.
Yeah. So now if you have research articles that are related to human research articles that are related to body weight, size, and growth, you can click on it here, and you can give a little definition like they did, just really short as to what it said. and what the impact was.
No, that's super. I like that.
I love it. This is great. You see the
Nice.
pictures.
Yeah. It's very well done.
Very well done.
And these are the folks. So I can, I'll reach out to Dr. Pelch and just, first of all, thank her. And also let her know, make sure we're okay. And obviously we'll cite the work she's done, and just so that people can use both of our sites together. That's a good idea. I like that. Yeah, so this is nice. So this will definitely be linkable from our site. That CDC, ATSDR, multi-site information on their website will link to all of our individual websites for each community as well. It's a lot of studies. All that. Okay. All right. Thank you. That's an excellent idea. All right. Anything else?
Personally, we had talked a little bit about our RAC committee and supporting us as we go through trying to understand what's going on, and then pushing for remediation. And I think that is a part of the community engagement piece, to let them know that you're not only here to research, but you're also a thought partner and an advocate for the community and helping us to get this remediation done as quickly as we possibly can. Maybe we don't have to do that now, but just offline what that might look like.
Right. And I think because they had asked me to write a summary literature for some of that work as well. So yeah, no, that would be good. Maybe when we set up our meeting for next week, we can add that to our agenda.
Yes.
That sound good? Okay.
Yes.
Can you, are you able to stay on for a minute or two so we can?
Yeah, absolutely. Absolutely. Absolutely.
Yeah, I was gonna say I gotta go here in a minute, but if you guys, Newburgh folks, this is gonna be so much easier for us. Like, we got 3,500 people here in the village, so we don't face half the challenges you guys do. So don't apologize for speaking more. You guys are gonna have much more work to do than we are in this. So don't apologize for that.
Thank you.
Well, we're glad we have everybody on board, and we're excited to get going, even though we start breathing. I hyperventilate a little. It's always nerve-wracking when we get things, trying to get things moving, but we'll get there. But we're glad we can finally move forward.
And as always, if you need anything, hit me up.
Okay.
Anybody,
All right.
I'm around.
All right.
Okay.
Thank
Good
you.
night, guys. You guys
Good
stay
night.
on. I gotta run.
Bye, Lorraine.
Bye-bye.
Bye-bye. All right. So I think we're good. We'll set up a call. You teach Tuesday nights?
Yeah. So yeah, the next three, the 27th, the 4th, and the 11th, and then I'm done. But thankfully, all I'm doing is students are presenting, so I'm just listening.
I'm almost to that point. One more week. How is Wednesday the 28th?
Okay, so now, and by the way, these don't have to be in the evening,
Okay.
so we can do.
Well, I have a block of time Tuesday between, and actually for the rest of it, I know people don't have to stay on if I think we're all done here. So thank you all. And obviously you're welcome to stay on if you have questions, but thank you all, and we'll let you go off for the evening.
Thank you.
Thank you. Have a good